being here. First meeting of 2021, and hopefully the start of some great things and some a good positive year this year. So I do want to welcome everybody. We do need to approve the meetings, the minutes from the last meeting from December 2nd. So do I have a motion to approve minutes? Did everybody get a chance to look at those, I guess?
I move to approve the minutes.
I'll second.
Okay, we've got a move to approve and a second. All in favor, please say aye. Aye.
Aye.
Aye.
Aye.
Okay, thank you. The ayes have it. So we're going to move on to Dr. Susan Johnson for her report since she has to leave early.
Thank you so much for allowing me to jump on the agenda at such late notice, but I actually wanted to make sure that Mayor Tecklenburg had received an update on this opportunity before I presented it to the committee.
I did, yes.
Okay, great. So I want to make sure that you were aware and were supportive before I presented this. So real quick, we, as you know, I believe it was in November or December, this committee presented our request to the City Council to approve our health and all policies strategy, which was approved. And so we have another opportunity to support that. There is a group of researchers and stakeholders that have been working on the effects of climate change on public health, in addition to resiliency, and flooding has been the main focus, but we also have been looking at the effects of heat, extreme heat. And we have an opportunity to apply for a grant that would allow us to collect data and kind of overlay that with public health issues, and hopefully will help guide our strategies around mitigating risk. Paul, do you have I know you sent the documents out, but do you want to pull those up, the Word, or do you want me to share it?
If you've got it right in front of you, if you would share it, it'd be good.
Okay. All right, can y'all see that?
Yes.
Okay, great. Paul sent this out. I'm sure you haven't had a chance to look at it yet since it went out about 5 minutes ago. But as I said, I wanted to make sure that Mayor Tecklenburg had a chance to lay eyes on this before I presented it. But basically, we would like to take an advantage of an opportunity to do some data collecting around extreme heat in our communities. The application is actually due on Friday, and Mayor Tecklenburg, you can speak to your commitment to that. But in our project team meetings, we really wanted to make sure that we had the support not only of our partners who will be engaging in this work, but also community stakeholders. And we felt like this committee was very aligned with the work, and it was also aligned with our health and all policies strategy. So basically the funding would allow us to, would really just cover the data collection, but it would be a springboard, hopefully, for us to receive additional funding. But it really is important for us to have that baseline and to be able to start to make those connections between extreme heat and public health and population health, and what we can do as a city to mitigate that. And so really the request is that we as a committee provide either verbal support. There may be an opportunity for us to include a letter of support to the grant application. And it really is just that we're saying that we will be providing advocacy for greater heat and health awareness through messaging campaigns and possibly the development of strategies for risk reduction. And you can see the project leads. The city has been working with Dr. Janice Barnes with climate adaptation partners. From the city, Mark Wilbert, who I believe was the person who presented this to the mayor, our Chief Resilience Officer will be representing the city. The Charleston Resilience Network will be the lead on the grant application, and then the partners include MUSC, the Charleston Medical District, and the Citadel. So we think it's a great opportunity, and I will stop and answer any questions, or I will let Mayor Tecklenburg speak.
Well, thank you, Susan. And yeah, Mark shared this with me. It makes all the sense in the world. It gets awfully hot here in Charleston. And as climate continues to change and temperature rises, I think this is just all part of our resilience and wellness efforts. I'm, always excited to partner with MUSC and the hospital district, but I was particularly glad to see the Citadel on there. They have that new climate change program. So this really engages them and engages us with them. So I'm very supportive. Thanks for bringing this to the table. And the only thing I would ask is when you list the partners that you include specifically the city of Charleston. We're all in.
Great. Thank you.
Thank you.
Mayor, does this need to go to city council, or is this a recommendation? How would you like a recommendation to go forth on this?
Well, I would like to share this with city council from the committee as a recommendation from the committee. We're not actually, the city itself isn't making the grant application, so I don't think we need to approve it at Ways and Means or anything like that, but we'd certainly include it with our report for approval from this committee.
All right, great. Do we need to vote on that, Mr. Mayor, or is that just something?
Yeah, if y'all would, that'd be great.
All right. So an approval to bring this toward city council. Can someone make a motion for that, please?
I make a motion.
And do we have a second? Okay, all in favor?
Aye.
Aye.
Okay, so we'll bring that before city council. Any other questions for Susan Johnson before we move on? Okay. Well, thank you, Susan. We appreciate it. I know you have a busy day, so thank you for bringing that to us and taking time to jump on and take that. Thank you very much. And, so we'll move on to what's actually now item number 3 on the agenda, the mental health resource update. And I'm going to call on Jennifer Roberts, if you will.
Well, good morning, everybody. Happy New Year. Let me share my screen here. Okay, can everybody see that?
Yes.
Yes, ma'am.
Okay. So I had asked Paul if I could present, because I know we often talk in this group and when I'm around our community, a lot of people don't know the resources out there for mental health. And I'm on part of this committee, and there's a lot of things our mental health center does. So I asked if I could take a few minutes to kind of give an overview of all of our programs and our services at Charleston Dorchester Mental Health Center. So we have a lot, so I couldn't, it was difficult for me to keep this short, but I'm going to try to do it just to let you know kind of what opportunities people have here at the Mental Health Center. So this is our West Ashley Clinic. I think everybody knows this, but we are part of the Department of Mental Health, so we're a state agency. Mental Health has 4 inpatient hospitals and 6 nursing homes. Probably something that you don't know about DMH is that we are the largest nursing home provider in the state, and it's not for people with mental illness. It's actually mostly for veterans. But the good part about us, we're one of the few states that has a whole continuum of care. So we have inpatient and outpatient services for patients around the state. We are one of the 16 mental health centers in our state, and we were the largest, and then Greenville and Piedmont combined, so we're kind of even with them. But we've been here for almost 100 years. So we have about right under 300 staff right now. And I can tell you with COVID and a lot of you other folks in the medical field probably having staffing problems as well, but we've been managing it. But we do serve about 10,000 people a year at the Mental Health Center. Not all of them open. We usually have about 8,600 people open to the Mental Health Center. But one takeaway for today, just so that you know, is that people can walk in either our Dorchester clinic or our Charleston clinic Monday through Friday, 9 to 3, and get a chart opened that day, whether it's an emergency or not. So I know in some places people will call and say it's a 3-month wait for other places in the area, but you can walk in here and get services today. One thing that's really important to stress is we couldn't do all the things we do without all of our partners. We house ourselves in probably 120 sites where we have people spread all over the county. And so it's just important to recognize, I won't list them all, but we couldn't do it without all of you guys. Lots of people on this call are our partners, and it's really important just to kind of say the best part about Charleston, I think, and for us at Mental Health, is that we do have so many people out there. We all work together so well. And again, we couldn't do half the things we do without all of our partners. I'm going to start talking about emergency services. So I believe everybody is probably aware we have a mobile crisis team here. It's since 1987, so 24/7, 365 days a year. You can call us and we will go out in the community and do mental health assessments. Law enforcement often drops folks off at our center instead of taking them to jail, which is really helpful for patients to get the treatment they need instead of getting put in jail. For 3 years now, we've been working with Charleston County EMS. So EMS can call us instead of waiting for us to come out to see a patient. We can do a video telehealth assessment. And it's really helped EMS not to have to transport so many people to the hospitals. We can get the treatment they need quickly and get people into hospitals or wherever and not have them crowd in the emergency rooms. We just started doing this with Mount Pleasant Police Department. And again, it saves everybody time and it gets people treatment faster. In October, we started working in 911 consolidated dispatch in Charleston. So one of our mobile crisis clinicians is sitting in there and we get calls passed to us. And again, it just expedites services for patients and hopefully keeps law enforcement and EMS and everybody, they don't have to be on the scenes as long because we're intervening kind of faster than we normally do. And a recent addition to what we do here in Charleston is we are now managing the statewide mobile crisis call center. So we take calls for all 46 counties all day, every day. So that's been an interesting ride since October to do that. But the good part is we're not having to send out as many mobile crisis teams in the state because we're managing a lot of them here if we can do safety plans and make sure people are safe. We do have a crisis stabilization center for adults. It's a 10-bed voluntary unit. It has been closed since COVID, and we've been trying to reopen it, but we're having nursing staffing issues. But we do expect to get it open in February, and all of you guys that are partners with us for that, we will certainly let you know the opening date for TCSC. We will keep the patient count low, obviously because of COVID. But it'd be better to at least open for a few patients than not open at all. So our adult services, we've got a lot of options for adults. Most of our adults are treated by large regional treatment teams. We're doing telehealth, phone services, and face-to-face services. At this point, as the mental health center, we probably about 50% of our services are done face-to-face, and about 30% we're using telehealth video, and probably about 20% at this point doing phone therapy with patients. But we have teams that go out in the community and do intensive community treatment for some of our patients that need to be seen more often. We have dual diagnosis teams where they're working on alcohol and drug issues and mental health. We have a team that works with the courts, and we have a mental health court where that's an alternative to a jail, and they work real closely with the treatment team and help them get jobs and kind of get them wrapped around. And again, they avoid having to go to jail if they successfully graduate from mental health court. For people who just kind of want a little help, I guess, because we do serve a lot of long-term patients, we do have a short-term outpatient treatment program. It's like 9 to 12 sessions for folks. And last year we started a geriatric psychiatry clinic. One of our doctors really specializes in that area and recognizes that elderly patients kind of need a little bit of a different kind of treatment. And so that's been going well on our adult programs also. We have 2 teams that work with early first episode psychosis, and it's for people 15 to 40 years old. One team works with people mostly with schizophrenia or schizoaffective disorders, and the other team kind of works with any other diagnosis, and it's also someone's first episode of psychosis. But the cool part about those programs are they are evidence-based, and families get lots of education. They have lots of help. They have peer support services, vocational services, and it's really it does really great things for our patients. Our Highway to Hope program is our RV. Unfortunately, it spent more time in the shop this past year than it did on the road, so we had to turn it back in, and we are waiting for our new RV. But our RV does go out to rural areas and down to 180 Place to provide treatment to folks who can't get to us. We have staff that are part-time at the Navigation Center downtown, and they also work with 180 Place. And we do have a team of 6 people that work at the jail, been there since the late 90s, and they're doing suicide assessments for folks in the jail. One hope we have for the future is to be able to add to that team so we can provide more treatment in the jail versus just suicide assessments. We do a lot of things with law enforcement here, but we do have a specialized treatment team for first responders. So fire, EMS, police, they get specialized treatment in a different locations. They don't want to be seen in our main clinic. We have clinicians embedded at the 4 big police departments and the 2 sheriff's departments working with victims of crime and people who've experienced trauma. They also work real closely with the police officers so that they're kind of an extension to our mobile crisis team. We do a lot of training here at Mental Health with law enforcement. We do the crisis intervention training, which is their 40-hour training on mental illness and alcohol and drug issues, and it helps them to better recognize and work with those folks in the community. And it just helps build our relationships with them so that they do utilize mobile crisis more instead of taking people to jail. We host the Low Country Negotiators training here quarterly. We do a lot of debriefings with law enforcement, and we're part of the South Carolina Law Enforcement Assistance Program. So we have a individual placement and support, which is a vocational team. So any patient here, no matter where they are in treatment and recovery, can ask to get help to get a job, and we'll help try to place those folks. We have a lot of adult patients that live in homes as part of a home share program. So it's kind of like a foster care for adults, if you will. We do a lot of training with those providers too. We have about 15 people that live with families here in the community. We have a staff here that will look into getting folks entitled if they don't have insurance. They can help them get Medicaid or Medicare. We have peer support staff. And these are folks who are self-identified people with mental illness who work as part of our teams and work with patients. And often it's easier for patients to work through some of their issues when they're working with somebody who also has a mental illness. We do have the ability to help with housing assistance. DMH gives us funds to do that. And I know we work closely with the city a lot of times to try to help pay for housing for folks. We do probate court evaluations for people who have been committed into the hospitals. And then NAMI has several support groups here at our buildings. We have a homeless outreach team called PATH, and we work closely with the city on this. And we have a group of folks that go out in the community and try to work with the homeless population, trying to get them hooked up with services, help them get entitled, also helping them get jobs too. And we do also try to work real closely with the jail for people coming out of jail so we can kind of get connected with them early and try to get them set up so they don't kind of fumble when they get out of jail. So that's adult program. So for kids, probably 95% of the services we provide for kids are in schools. We are in 111 schools in Charleston and Dorchester counties right now. We normally have about 77 school-based clinicians out there. Some of them are in schools every day of the week, and some are they go to schools maybe 2 or 3 days. As you know, with COVID, kids have been in and out of school, but we've been trying to, we're either in the schools or we're at home doing telehealth appointments with those families. We did have a little, I guess, trouble in the beginning with COVID with getting connected with kids, but now it seems like we're definitely getting a big uptick in people wanting help for their kids, which we did expect it to kind of take a little bit of time for people to get settled out and kind of realize that they needed extra help. But we've got clinicians at Low Country Child Advocacy Center. We have a new MDFT team, which is multidimensional family therapy. So that's a very intensive team that works in the homes with families. Usually they're DJJ or DSS families, but it's very intensive and also evidence-based. It's similar to MST, y'all might have heard of that, but we are taking referrals for that team as well. We work in DSS. We have a group that works just with youth and transition age kids. So they're, again, focusing on vocational skills and other things that young adults need to help them be successful in life. And DJJ has been one of our partners for years too. And we have staff that are at DJJ working with families as well. One of our newest programs is Infant Early Childhood Mental Health Consulting. So we are working with the South Carolina Infant Mental Health Association. And so we will be working with providers, daycare providers, and foster parents and regular parents for very, very young kids, 0 to 5, who are they're noticing that these kids are going to need some help. And hopefully we can intervene early and help the caregivers learn how to manage these kids so they don't end up in mental health later. I think I mentioned we have staff that are in all the police stations and sheriff's departments, and they do work with kids and adults. We also have a parent-child interactional therapy program. That's another intensive program for families, and it's also an evidence-based treatment that we do here. And again, kids are obviously, a mobile crisis is available to everyone. So we have 12 doctors here on site, and we partner really closely with MUSC for our medical services because we usually house about 30 residents a year here that they go through here training, and they also help keep our crisis stabilization center open because they're the ones that are on call. So patients can either get therapy here and medications or no medications, or some of our patients are just medication only patients, but we've got a wonderful, wonderful medical staff here. So we have FEDER over here. They stopped for a while this past year due to COVID, but we do have primary care offered here in our West Ashley clinic for our patients. We've got prescription assistance programs, care coordinators who work with patients to help them find housing or help them find primary care or kind of whatever their needs might be. FEDER was bringing their dental RV over here. We're hoping to get that going again soon. At this point, FEDER's just started coming back, and they came in a big bus in our parking lot, and they're coming, I think, once a month right now. And I know we've mentioned the South Carolina HOPES grant that DMH got, so I didn't want to not remind you about that. That is for healthcare professionals who need some help from COVID. Also for anyone in the community that's experiencing increased symptoms from COVID or new symptoms from COVID, we have a team that will work with them and help pay for some of the funding. It'll help pay co-pays and also help inmates get medications paid for that are coming out of jail. So we do a lot of training here. I mentioned that we train with law enforcement. We train closely with Charleston Center, so we're training their staff about mental health, and they're training our staff about alcohol and drug treatment. Hopefully you guys have come to our Low Country Mental Health Conference. We did have to skip it in 2020, unfortunately, but we're hoping we'll have it back at the Gilliard in July. And the other thing that we do is free trainings to the community on child and adult mental health first aid. These are 8-hour classes. And we have 4 trainers here. So if anyone's interested we can do it even in parts, even like 4 hours one day and 4 hours another day, if anybody's interested. But it helps teach people what to look for and recognize symptoms of mental illness and then what to do if you know somebody who needs help. Just I wanted to put a plug in for our conference. We're hoping to get it back going. We had 1,500 people the last time, so obviously when 2020 happened, that wasn't going to happen at the Gilliard, but please sign up to come. It's going to be great. We're part of a lot of coalitions and meetings and councils, just as many of you are, so I just wanted to list a few of them here, but we do pretty much go to everything we're invited to, and we are invited to a lot, and we appreciate that because, as I said, we have lots of partners and we all work together so well in Charleston. We do a lot of community outreach here too. We haven't obviously been doing it as much with COVID, but we do try to get out there with the media. We do lots of festivals and conferences and health expos. Art of Recovery is part of Piccolo Spoleto every year, and this is held at the Circular Church. We have artwork from patients from around the state that they're selling their art, and it's really a beautiful event, and I'll be sending y'all information about that as we get closer, and hopefully we'll have it again this year. We do have a pharmacy van. This is our van, and it's actually at Charleston City Police Department, but this is a group of us in Roper, MUSC, EMS, Feder. Everybody's goes down to Mall Park. It was weekly before COVID hit, and then we stopped it for a while, but it is back. I believe we're doing it once a month, but we're giving out vegetables and fruit to the community and trying to get these folks connected to treatment of any kind. So it's really, it's to help reduce stigma and to help people know where to go get help. And Mental Health Heroes is our nonprofit that we're associated with. They help a lot of our patients get medications paid for, clothing. We were able to give $5,000 worth of socks and clothes to our adult patients this Christmas, and a whole bunch of gifts for kids. So they help fund what our patient needs are if the mental health center can't pay for it. So it's been a wonderful thing to have a nonprofit that supports us. So in closing, I've got mental health mobile crisis numbers up here. And I just wanted you to know that we really have 130 plus places you can go and get your chart open with the Charleston Dorchester Mental Health Center, because we are everywhere besides our two main clinics. And TCSC, as I said, hopefully will be opening in February. But just, you know, when people are asking where to go and it might take too long to get treatment, it won't. You can walk in today, and if you need help paying for treatment through SC Hopes, we can help people get the treatment they need, possibly at no cost to them. I put a lot of our contact information on the last page so that you guys would have it. And I'm just really thankful for the opportunity to work with all of you. And again, we do this as a team. I mean, we as I said, we're all over the place and we can't do it by ourselves. So, but I just wanted to share that with y'all so you kind of knew some of the options people have at your community mental health center.
Thank you, Jennifer. Great report. A lot of information in there, and your team does a great job. That's outstanding. A lot of work. I guess just a question for you. Is there anything further that the city of Charleston can do for you to help support you and your team?
I mean, not right now. The city of Charleston's already a partner of ours, and they help pay for our clinician that's out on the PATH team at working out in the community. And we work with the Homeless Coalition, and I think we're doing great. Just keep doing what you're doing and being partners with us.
Well, thank you. Any questions for Jennifer?
I just have a quick question. Are the walk-in hours, those Monday through Friday hours, are those open to pediatric patients?
Yes, yes.
Okay.
Jennifer, thank you for that update. It's good to be refreshed on all the activities and programs you have. I'm not quite sure how you keep up with all of them, to be honest with you, but thanks for your partnership with the city and so many others in the community. And I'll be glad to hear that 10-bed unit gets reopened this year and we get back to in-person services and outreach, but y'all do a great job. I hope y'all can get that cupola repaired on the top of the Babcock building that you showed early on.
Right. Well, thank y'all. We appreciate all of you and your support. And thanks for letting me have some time.
All right, thank you again. And I guess we'll move on to item 4 on our agenda, and I'll call on Katie Richardson for a COVID and health update.
Thank you, Kevin. I see Tracy's on. Tracy, do you want to give any sort of data update to start?
I'm happy to do a brief update if that's appropriate. So
Be great.
I see Paul, okay, nodding his head. So let me share my screen. I just have a couple of slides. So I'm going to start off with something that's very positive. I'm sure y'all are tired of me talking about cases, and more cases. So it's pretty exciting to be talking about vaccinations. So just a brief update. We are opening our MEOC. That's going to actually start today with a small team to kind of look at how we can prepare and be ready and help with vaccinations however the city can and wherever it's appropriate. South Carolina, according to the CDC, South Carolina has received about 288,000 doses of both the Pfizer and Moderna. And also on the CDC website, they're reporting that South Carolina should get another 60,000 doses next week. From DHEC, so Katie, hopefully this is right. This is what I've got on the website anyway. So you can see the number of doses that are coming to MUSC as well as to Roper and how many of those have actually been administered. And that's pulling from, I think, let's see, yesterday at 12 p.m. So I think the reporting on administering the vaccines is a little delayed though. So I'm think that that's a little bit higher percentage, but that's all that they've been reporting so far. And so you see the county numbers kind of everywhere. So I kind of like to share how things are looking kind of at the city zip code level. So this is just our daily new cases as well as kind of that rolling 7-day average. So you can see we've got a nice little spike here recently due to all the holiday activities. So that's definitely something we're, keeping an eye on. And I think over the next probably 5 days or so, it's going to be interesting to see how that continues. Hopefully that trend will start to make a downturn, but that remains to be seen. Here's the hospitalizations for Charleston County. So you can see we're already on the increase. So with that spike at the end, we're not quite seeing those hospitalizations yet. So that is a little something to keep an eye on as well. And through reporting, it looks like we have, at least in Charleston County, about 28% occupancy right now in our ICU beds. So we're doing well, I think, comparatively, especially when you look at how hospitalizations and cases are in the upstate. But I think it's still something to keep an eye on and make sure that we don't, that the rate of increase that we've seen here recently doesn't continue and we start to actually make a downturn. And we did update our dashboard and made some changes to some of our metrics. We worked with the epidemiology team at MUSC to make some tweaks. So that is available on the new dashboard. So you can see 2 of our indicators are currently yellow and 2 of them are red. All things to be keeping a very close eye on. Really quickly, city employee cases. We currently have the highest number of employee cases that we've had since the beginning of the pandemic, which we did a great job in July. And I think, we're just seeing COVID fatigue set in. People are really, really tired of it. I think people were anxious to spend time with their families over the holidays. And so I think we're seeing the impact of that, and at least in our employee population. And I just can't say enough good things about, the safety and wellness team and all the contact tracing that they've done with city employees. 990 employees have been tested and contact traced in the city since the beginning. That is a lot of work that Jan and Paul and that team have done since the beginning. So really big kudos to them. And that's really all I have this morning. So I'm happy to answer any questions, but turn it over to Katie.
Thank you, Tracy. I got a couple of questions, if you don't mind, for Tracy. When you were talking about hospital bed availability, do you know if we have people coming in from outside of our area using local hospital beds? I mean, I don't know, that may be a Dr. Richardson question. I don't know. Or is it all local people in our hospital beds right now in the ICU in those areas? I'm
not sure. All they do is report kind of bed uses by those facilities in each county. So I think some folks on the call are much more able to answer that question than I am.
I have a question. I mean, Tracy. I think it is a combination. Certainly MUSC is a referral center for much of the state. And so some of those would be, and we know that from our region, that people are transferred in really from all over the low country region if they need a higher level of care. Annie may know better, but I would still say probably a majority of those inpatients are local from the Tri-County region.
Right. And Tracy, do you know, when you were talking about city employee cases, are those actually city employees, or are those people on the city insurance? Because I know we have a lot of family members that are on our city health insurance program. Are those actually, are we breaking that out, or is that just somebody that's on our insurance?
I'm 99% sure that it is all city employees, and I see Paul nodding his head in agreement. So I think the contact tracing, obviously if spouses are involved and things like that, those sort of questions are asked, but those numbers are strictly employees.
Okay, thank you.
You're welcome.
Carolyn had a question.
Yeah, I was just wondering if there were any particular trends you noticed, Tracy, with city employees, any particular departments?
Yeah, so that's a really good question. Obviously, we know that some of our employees are more vulnerable simply by the nature of their work. For example, fire, those guys live together, eat together. So it makes it really, that's been a really challenging department to keep really safe. So luckily those guys are getting vaccinated right now. So that's really good. That's probably been the biggest challenge. Of course, our police officers are out there. We do have some employees that, just by the nature of their job, ride together in vehicles. And of course, we've done everything that we can to try to keep everybody as safe as possible. But there's definitely some that have, just by the nature of their work, are exposed a little bit more than others.
Thank you, Tracy.
Sure.
Any other questions for Tracy? Dan?
Yeah, thanks. I had a quick question, and it may require some speculation, so I apologize. But Tracy, you mentioned there is a significant difference in infection rates in Charleston County as compared to the upstate region. I wonder if we might be able to try to identify why there's that difference, and if there are things that we're doing particularly well that we can continue to do well and emphasize to try to keep our rates low. Or just had a question, is it purely a function of temperature outside, or might it be something other than that?
Yeah, I mean, that's a great question. I was asking some of those questions of Katie not all that long ago, because, I think we've been kind of braced for the same kind of outbreak of this virus that we've seen in the upstate, simply, thinking that it was a function of temperature. Yeah, I mean, I'm just speculating too. So I think we've been fortunate with our with the temperatures. People are able to be outside a little more, or more comfortable outside a little bit more. And this is just anecdotally. I mean, people that I've talked to, fellow employees that have been traveling, you know, just kind of anecdotally feel like there's more adherence to mask wearing here than there are in other places. So I would love to think that all the work that we've done to you know, with messaging and with the mayor's leadership to really encourage people to wear masks, and all the enforcement efforts, you know, by our livability folks and PD and fire, I would love to think that that's had an impact, but I don't have any hard data to, of course, really back that up.
I mean, I appreciate that, and I don't want to go off of speculation, but as we try to battle fatigue, you know, I wonder if just a question for the group: is this an opportunity to sort of give out a positive message that the things we're doing are working? So please keep your masks on, keep doing what you're doing. It's having an impact, and sort of demonstrate that. I don't know if there's an opportunity for that or not, but Mr. Mayor, maybe something like that coming from your office to say, hey, we're winning. We're doing some things well. Keep up the good work. You know, that kind of an attaboy, attagirl type message. I don't know if that would work or not, but just a thought.
Well, that's a good thought, and I've certainly tried to relay similar tones in my messages about keeping up our guard, but also congratulating and thanking the citizens of Charleston for being more mindful about mask wearing and their health than what I perceive and what I hear has occurred in other places. But you know, you can't rest on your laurels. We got to keep this up. We can see the clearing up ahead, but we ain't out of the woods yet. But you know, Katie might confirm, but a few months ago, DHEC confirmed with numbers that the jurisdictions in the state of South Carolina that had mask ordinances had a bona fide better success rate than those jurisdictions that did not. I was speaking to a counterpart just recently over the holidays in Greenville, where ironically, Greenville County, having over 500,000 in population, was the only local jurisdiction in South Carolina to receive direct CARES money. And his comment to me was that the county had done, until recently, very little in a proactive sense about policy or otherwise to promote masks or put any ordinances in place. And I think there's a real difference in what we've seen. I wish I had gotten their financial support, but anyway, you're right. We just need to keep preaching the message, thanking folks, and I say, if you hadn't gotten your guard up yet, it's not too late to get your guard up and put your mask on. We still got a few months to go to try to get to a place where we got the herd immunity. I call it the herd mentality, but I use the wrong word.
Okay, very good. Any other questions for Tracy specifically, or I guess we'll, Dr. Richardson, you want to continue with your DHEC report then?
Sure, thanks. And I really appreciate Tracy and pulling together the numbers each time. I think she and the city do a great job of presenting what is going on with, I know it's some MUSC assistance. So thanks for that. The one thing, just as far as data, and this sort of goes along with what Dan and the mayor were just saying, but another thing is really the testing. And so just looking at statewide numbers, you know, we tested, not we, just DHEC, but we, the state, more people tested in December than any other month to date. We had more than 553,000 people test, and 440,000 of those were testing for the first time. And so I think that sort of testing frequently message, testing if you're symptomatic, testing if you've been exposed, testing if you've traveled, and then just testing when you're out and about in the community is a message that I think that the mayor certainly did a good job with some of his messaging in December about that, and I think is a message that we can continue to try to spread in the community, that that yes, there's light at the end of the tunnel with the vaccine, but the testing is going to continue to be a big component of our response until we do reach herd immunity. Other than that, I assume most of what's on people's minds these days is the vaccine. So I'm happy to, address any questions other than the vaccine, but I thought I would sort of spend some time addressing that. Many of us likely heard the governor's press conference yesterday, or read about it in the paper this morning, but he is encouraging DHEC and the state to move as quickly as possible to get as many people vaccinated as possible. And so there'll be some changes coming out from DHEC in the coming days to help make that a reality. But basically his mandate was for those in phase 1A, meaning really the sort of healthcare providers. We are the Moderna vaccine right now is going to long-term care facilities, both residents and staff. And that's a federal program that the DHEC allocates vaccine, but that's really being run at the federal level. So that will continue as it has been, but that the sort of other phase 1A group providers, there will be a huge push to have those providers receive the vaccine or schedule their appointment for the vaccine by January the 15th. And that will be accomplished by the help of the hospital systems that are already getting vaccines in South Carolina. And we are very appreciative for their help. And as Tracy showed with her numbers, MUSC and Roper have certainly done a great job, not only of vaccinating their own employees, but now are reaching out to the community and also assisting in vaccinating sort of community health providers as well as our first responders. And so it will not only involve those, but there will be additional vaccine providers brought online in the next week or two. At least 92 have been activated as of yesterday. So those are vaccine providers that had applied and have been approved and now have been activated. So we'll be able to put in request for a vaccine and receive that from our allotment. And we hope that that helps to increase access to the vaccine across the state outside of the healthcare systems that have been providing the vaccine as well. So, so we're at now 704 approved COVID providers, and those include primary care, subspecialty care, FQHCs, rural health, free clinics, retail pharmacies, and I don't have an exact breakdown of the 92 that have been activated, but those numbers will continue to increase. So that means providers have been approved, and now we will work to continue to expand those that are able to give out the vaccine. DHEC also will begin providing the vaccine soon. Other than that, we're getting a lot of questions, no doubt you're getting a lot of questions for what phase am I in? When can I get the vaccine? Where can I get the vaccine? When am I going to get the vaccine if I'm a vaccine provider? And we are really working around the clock to sort of put those processes in place. And, what I can say is I think South Carolina is similar to much of the rest of the country. It's similar to much of the rest of the world, that that providing vaccine to the public is not going as quickly as we had hoped, but we are already seeing and continue to believe that distribution will increase in the coming days and weeks. So our DHEC website it's sort of the single best source of information right now. It's updated daily. There are also a number of email addresses that individuals can query if they have questions about where they are. But 1A we've already talked about. 1B really begins to get into persons 75 and older, regardless of comorbidities, as well as frontline essential workers. So essential workers who, by the nature of their job, are at increased risk for exposure to COVID. Some of those include firefighters, law enforcement, corrections officers, food and agricultural workers, those working for the Postal Service and manufacturing and grocery stores, on public transit, and our teachers, support staff, and daycare workers in the educational system. So that will be the group 1B, the phase 1B. DHEC is basically taking the recommendations of CDC and applying those to South Carolina. That'll be followed by phase 1C, and that will be persons 65 to 74. Persons 16 to 64 with a high-risk medical condition, and essential workers that were not covered in phases 1A and 1B. So exactly where and when folks in 1B and 1C will begin getting the vaccine will not only be announced on the website, but we hope to use many different methods of getting the word out, including the help of all of you on this call when those decisions are made. Other than that, I did want to just mention briefly the one silver lining of this year of the COVID pandemic is that so far flu is virtually non-existent in our communities. So we do continue to recommend the vaccine. We certainly have several months left of what is the typical flu season. But the recommendation from the CDC is that if you receive the flu vaccine, you do need to wait for 14 days to receive the COVID vaccine, or vice versa. So they cannot be given the same day or any closer together than 14 days. And then lastly, I don't have much of an update, but did want to just bring up our Fast Track Cities initiative to end the HIV epidemic. Several of us are meeting this afternoon to talk about next steps. Our grant application was not funded in December, so we are going back to the drawing board for thinking about sort of how to move forward on that. But the state is finalizing the statewide ending the epidemics plan, and we will work to align with that, and we'll continue to bring you information as we have it. So happy to answer any questions that you may have.
Joey?
Dr. Richardson. So with the understanding that the vaccine is a 2-dose procedure, so that folks will get 1 dose, and then depending on which type of vaccine, they'll have to wait somewhere around 21 to 28 days later to get that second dose. There is some concern with supply and demand that folks will get that first dose, and then they'll have to wait a little while to get that second dose, depending on if we provide that first dose widespread, or if we hold back some with the understanding that a bunch of folks are going to need that second dose right away. My question is, do you know off the top of your head the percent effectiveness of just 1 dose of the vaccine versus having the complete series?
Well, I'm not sure I want to be quoted on it off the top of my head,
It's okay.
but I do think, and someone can correct me if I'm wrong, but I think it's over 50% effective is what at least the Pfizer studies found with the one dose. That being said, the CDC and the FDA continue to recommend that the vaccines be given as they were studied, which is the full dose given in the 2-dose series, either 21 or 28 days apart. Dr. Fauci as well does say, yes, we're, going back and looking at some of the different arms that were done. I think maybe it was the Moderna study did have some people who received half of the dose, and they're going back to sort of pull those blood samples and restudy them. But at this point in time, the plan is to continue as the sort of emergency authorization was based on the studies of the 2 doses. And we're going to watch what other countries are doing, because certainly we know that Great Britain is choosing to do things a little differently. But at this point in time, until we have further notice from the CDC and FDA, we will continue we're asking hospitals not to save back for that second dose. We are sort of ensuring that that second dose is sent in addition to, the supply of first doses to hospital systems, so that they don't need to save, but they will get the number that they need to provide that second dose on the time schedule that's recommended.
Thank you.
Dr. Katie, I'm sorry. Did you have another question? Oh, I'm sorry. That's, though, of course, coronavirus is top of mind. It is encouraging to hear what's happening with the flu. Do you attribute that to people simply being much more aware? Because, of course, flu is generally considered so impactful in South Carolina, with people not getting the vaccine traditionally. You've seen a change in that?
Well, I do attribute it mostly to sort of the same things that we are doing to prevent COVID, also prevent the flu. So the frequent hand washing, the wearing of masks, the staying home when ill, all of those things also prevent transmission of flu. We did see lower flu numbers in the Southern Hemisphere, and weren't sure if that was going to translate. And again, we certainly don't know if the flu numbers will continue to be low into the spring, but we are grateful that is the case. We certainly don't want to further overwhelm our healthcare systems, but that's those are at least some of the reasons that I suspect that the flu numbers are lower this year.
Thank you.
Paul?
Katie, I'm hearing from some of the young people around their concerns of what they heard from Australia earlier about the side effects of the vaccine, from the HIV to fertility issues, et cetera. I know there's campaigns out there, and there's been some good articles in the paper and all, but it seems like that's a market that really needs to we've got to focus on making sure they realize that they're not invincible and they need to get the shots just as well. And I didn't know whether there was anything on age group specific going out to help try to ease the mind that what we have is a good, safe product to go forth with.
Yeah, that's a great question. We are certainly developing outreach materials, all sorts of demographics. Right now, we're really sort of concentrating on the healthcare providers. The one benefit for young people is that there will be so many others that get it before them, unless they have a high-risk medical condition, because they will, they basically will mostly fall in the phase 2, unless they, because of their job or that sort of thing, fall in an earlier phase. We know that vaccine misinformation is a huge topic, and we are working diligently, and certainly our partners are well to combat that and use evidence to show that these vaccines were well studied, that yes, people have, pain in their arms. Many people have pain in their arms, that there's also some fatigue, some joint pains and muscle pains, but that those are time limited, that they are not severe, and they can be treated with ibuprofen or Tylenol. And that is really more than a side effect. It's really a sign that these vaccines, that our immune system is responding to the vaccine and will be ready to fight off the infection if and when we are exposed in the future. And so that's where we are with that right now. But we will continue to roll out new campaigns, as will the CDC and our partners, as new sort of groups are in line to receive the vaccine.
Thank you. I see Mayor Tecklenburg has a question.
Yeah, a comment and a question. Katie, thanks for all you do personally. And it's clear that DHEC is the gatekeeper of this effort here in South Carolina. As Tracy mentioned, we've actually activated incident team to be of any assist that we can. And so I know with new protocol coming out, and I applaud y'all trying to ramp things up. Please bring us along and let us help you in any way that we can. And maybe you don't know the best way, but I did want to also kind of challenge everybody on the committee, because one thing that I think we can all do right now is just to get the information out that Katie, DHEC, that the other healthcare providers provide, and try our best to get it out to the public now, even before they can line up to get the vaccine, to go ahead and satisfy people's questions about the vaccine, the side effects, if you will. But I would stress the benefits of the vaccine more than Carolyn. I must admit, I was watching one of the channels. I hate to say, I don't recall if it was 2 or 4 last night. It was one of the 2, where the lead of the story was about the side effects. Maybe the lead of the story ought to be about the great benefit that will come to our community once everybody gets vaccinated. Yeah,
innocent. It wasn't us, Mayor. It wasn't us.
You get a shot in the arm, yeah, it hurts a little bit, okay, I mean, duh. So, but I think the more information we can get out to the public about the frequently asked questions and answers, the better we're going to be, so that as the governor said yesterday, once it's available, we want you to step up to the plate and go ahead and get the shot, as opposed to, well, no, I don't know, let's go ahead and try to answer those questions now.
Yeah, I think those are great points, and we certainly welcome any assistance with both the getting the vaccine out to our communities, as well as getting the word out. And I do think that already, the number of healthcare providers who have gotten the vaccine and, put themselves on social media and talked about the benefits and, what sort of side effects, if any, they've had and how they've overcome them quickly, I do think is helping. And I think we'll continue to look for sort of community leaders to assist us in working with all different segments of our population to ensure that the trusted voices in all communities help to get the word out about the benefits of the vaccine, the risk of the getting the infection, and so that everyone will be ready to come to the vaccine clinic when they are called. Any
other questions for Dr. Richardson? I kind of see Dr. Annie Andrews leaning in a little bit. I don't know if you would like to take some time and share some things with us. Do you have anything?
Oh, no, I was just agreeing with everything Dr. Richardson is saying. I think she's got excellent messaging. And anecdotally, I got my second dose yesterday and I feel great today. My husband did as well. So yeah, we're trying to share as much as we can on social media. I think that's a really good strategy.
Great. Thank you so much. And I see that Maggie Dangerfield doesn't have her video on. I don't know if she has the ability or wants to tell us. I know that Charleston County Schools started back on Monday. Maggie, did you want to say anything?
Kevin, she might not be able to. She's listening in, but she's having to teach a middle school class, I think, or in the school today with the shortages and all. So.
Okay. All right. Great. Dan, you have anything from the Citadel?
Kevin, really not much to report now. General Walters is going to be holding a town hall meeting this afternoon at 15:30 to give us an update on our plans going forward. And I'd be happy to share any results from that out to the group afterwards. But we're going to have a sort of a State of the Union address a little bit later this afternoon. So not much right now.
Great. Thank you. Joey, anything from your group?
Nope, just happy to have the opportunity to be a sounding board for all this great messaging and to share it out amongst all three of our counties.
Okay, great. And Paul, do we have anything further here?
I think we have had a good discussion today. And I really, with Jennifer's words, I know the mayor, we talked about COVID and getting the message out, but all that we've got with mental health. I gave everybody her PowerPoint earlier this morning, and if you would just keep her contacts available to you, I mean, just so much, we've got great resources, but people just need to know about them as much as possible. So whatever we can do, I really appreciate any help on it.
Okay, great. Anyone else before we wrap up here? Anyone else have anything? I don't want to leave anyone out. So.
Kevin, I will say one last thing. I'm going to send out, we will be doing the first Wednesday of every month, and I'll send out that calendar to you in the next couple of hours. But I'll also send out a calendar invite if I hadn't already to remind everybody about our meetings. The first Wednesday at 9 a.m.
Okay, great, Paul.
And my last comment is that Anton reached out to me, and Mayor, I'm not sure. I thought he tried to reach you, but Anton is going to be leaving our MUSC community and from our committee to go to work on the personal side of the great speech maker that he is and motivator that we will have him in our community, but we won't have him on our committee or at MUSC in the future. So we're going to miss him.
Yeah, we will. We sure will. Well, I want to tell everybody, thank you. A lot of positive things in this meeting, and as we turn the new year, and hopefully things will continue to stay positive, and we'll continue to, see things move in a great direction with the vaccine, and hopefully that translates into the number of cases beginning to reduce. And I just want to thank everybody for all your great work. Obviously, it's been mentioned that Charleston has come out a lot better than some other places, and a lot of that credit should go to the people on this committee, because we've taken the advice and have shared information that I think has helped us be stronger. Certainly the weather plays into that, but I think this committee does as well. So before I leave, I do see Maggie showing up. Just want to make sure she doesn't have something before we adjourn. Maggie?
Kevin, she did send something in the chat, a quick update that their nurses are getting vaccinated currently. Winter athletics are still suspended for the moment and will be reevaluated on Monday. Their board of trustees meeting this upcoming Monday, January 11th, for their monthly committee of the whole meeting. There's a great presentation at their last board of trustees meeting on December 14th by Dr. Richardson and Dr. Allison Eckert from MUSC on COVID cases in schools and how transmission within the classroom has been very low based on contact tracing, et cetera. And that can be viewed on YouTube. So that's what she wanted to send out.
Great. Thank you so much, Maggie. Appreciate that. Thank you for all the work that you've done in the schools too. We appreciate it. So, if we don't have anything further, I guess we'll stand adjourned. I just want to say thank you again and keep up all the great work. Thank you so much.
Thanks,
Hope
everybody.
everyone stays healthy.